Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls at 866-870-5752. Call now and get your free book today, Dr. Darrow's latest, called Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the subtitle. The foreword is written by Suzanne Summers, and it has 264 scientific studies. What do you think, Dr. Darrow?
I'm loving it, as always, Nita. Should we go to some of our callers here right now? Let's go to Steve.
You got it.
Steve, Dr. Marc Darrow, how are you? Is there anything with stem cells for Parkinson's?
Pleased to talk to you. I've got Parkinson's disease, and I wonder if there is any potential application for regenerative medicine for Parkinson's disease.
I'm going to make a guess on that. It's not the kind of work that I do, Steve. So I don't have a definitive answer for you on what the results are. I'm sure someone is working on it because the substantia nigra, which is the back of the brain that has to do with fine movement, is the area that is being attacked, okay? And I can't see any reason why stem cells wouldn't help regenerate that, but I do musculoskeletal work, orthopedics, and I'm not up on the research in that area. What I would do if I were you is I would do a Google search for research on stem cells for Parkinson's disease. And it'll probably lead you to some studies that are being done. And typically in this area of stem cells, you want to stick with university-driven studies, okay? Because they're watched very closely at the university level. You might find someone, a doctor, who will say that they can give you IV stem cells and it'll heal Parkinson's. I'd be very careful of that, okay? Do you understand what I'm saying?
I do. Okay. There is a UCI study being done right now that amounts... the substantia nigra is hard to get to. Yeah. The putamen is closer to the skull. It's less dangerous to get to. So They are doing a study with injecting stem cells into the instead of the substantia nigra.
Okay. Well, this isn't. Let me just say this, because the show really is not about neurology, which you're getting into here. I'm glad you called though to ask about it. But there are guys flying under the radar. I'm not one of them, who do IV stem cells, and they say it works great on everything. I don't know if that's true or not. So if it were me, I'm just telling you, if it were me, I'm not telling you what you should do or anybody else. I experiment on myself, and that's why I do regenerative medicine. I started experimenting on myself 25 years ago doing this, and at the time, all the other doctors thought I was absolutely insane. But guess what? I healed my body, but it was in the orthopedic realm. You know, I had pain, I had joint injuries, tendinopathies, things like that. So you got to get on the horn, meaning the internet, and start doing some research of your own. And I can't guide you there because I don't want to lose my license. And a lot of these guys don't care. They're pioneers, but you'll find them. They're out there, okay? And God bless you, Steve. We're going to move on to Britt right now. Britt, you've got lower back and neck pain. This is Dr. Marc Darrow. Britt, how are you doing today?
I'm doing good. How are you? Can you hear me?
Oh, yeah, I hear you. Is your name Brett or Britt?
It's Brett.
Brett, okay. I have a daughter named Britt. All right, so you have low back pain and your neck pain, and how long has that been going on?
Yeah, about 4.5 years ago, I was rear-ended at a high speed.
How fast?
And I'm going to guess anywhere between 50 and 60 miles an hour, and I was pretty much at a dead stop almost. I was just starting to make a left turn when I got hit.
Okay.
So I received physical therapy. I saw an orthopedic surgeon, and basically when I think it was lumbar 4 or 5 was rotated about 15 degrees.
Okay.
And he was saying that at the nerve sac at the very end of the spinal cord, he was saying you're eventually going to need back surgery.
Okay.
And then they showed me a diagram of how they remove the muscle and cut the bone off and scrape around the end of the spinal cord. I was like, there's no way I will need to take a chance of doing that.
Yeah.
So I've been getting chiropractic and massages and stem, but it's not getting any better. I wake up with numbness going down my legs and my hands. It eventually goes away.
Yeah.
And it's just nonstop. Well, I'm uncomfortable. It's made it difficult for me because I'm pretty physical, and working out I have to be careful because not to injure myself more. So I work with a trainer, but I'm not getting any relief from the pain.
Okay.
And I know there's got to be a different way to go.
Well, there's two issues going on here. Number one, you have pain in the neck and you have pain in the back. Is that correct?
Yes.
Okay. And then you have an occasional numbness or tingling down the arm or leg or the hand, whatever that is. So they're really, in a sense, unrelated issues. Now, people always come in and they go, well, my leg is numb and I have some back pain. Would you fix my back? And I go, well, I can probably help you with the back pain, but not the leg pain. But they go, the leg pain or the numbness is coming from my back, right? And I go, yeah. But it's still two different issues because the back and neck pain is local pain, okay? That's not coming from a nerve being pinched. But if a nerve is being pinched, where the foramen, which is the opening from the spinal cord where these nerves go down the arms and legs, if that's being pinched or has stenosis, as we might call it, then you get what we call the paresthesias down the limbs. And they're two separate issues. So very often, and there's another issue. This is very complex, by the way. There's another issue, which is that you can have what we call trigger points in the neck or back that actually can refer down the arm or leg when it is not anything to do with a nerve being impinged. Now, I don't look at an MRI to decide what it is. I use my hands. I have to examine you and move you around to find out, number one, where is the pain being generated from? And number two, are those radicular symptoms, meaning they're going down the arms or legs, are those coming from the back, or is it something that is more local to the area? Because if it actually is a nerve that's impinged, let's say your hand, that could be carpal tunnel syndrome, it could be cubital tunnel syndrome, it could be an impingement in the neck. There is a study that we can have done. It's called an EMG nerve conduction study, electromyogram nerve conduction study. And if there is an impingement, there's an 85% chance that study will let you know where it's at. The study has a 15% failure rate, so we have to be cautious about reading the results from that also. It's a very complex thing you're going through. It's not as easy as looking at an MRI and telling you you're going to need surgery. I abhor doctors who say that. Let them get the surgery, see how they like it. There's a high probability from what you're telling me that we can inject your low back and your neck and get rid of the pain. I'm not going to tell you a thing over the radio because I don't know. I'm just saying there's a high probability from what you're telling me that you can be healed without surgery, okay? I have to examine you, use my hands, move you around, see what's going on, and get a better idea of what's happening to you personally. Understood, Brett?
Yes, I do. That sounds great. So I should give your office a call?
The number there is 800-300-9300. I'll repeat it for other people. It's 800-300-9300. And people can also email me through my website, and I answer every email every day. It's www.lastemcells.com, www.lastemcells.com. And I'd love to see you, Brett, and let you know what's going on, and take away that concept and probably the fear that you may have that surgeon gave you that eventually you're going to need a surgery. That's just a bunch of hogwash.
Yeah, I've known too many people that have had back surgeries and they wish they never did.
Yeah, well, me too, because I get patients every single day who come in who have had a failed surgery where they go, I wish I hadn't have done it. And I'm not putting down the surgeons, because believe me, man, I love the surgeons. I call the surgeons all the time to do second opinions on my patients. I just had one, a guy came in and his leg was swollen and ecchymotic, meaning black and blue, and it was an inch bigger than the other one. And all the people he'd seen did not have the wit to get an MRI, which I had done. He had ripped off the hamstring from the ischial tuberosity, and I immediately sent him to a surgeon buddy of mine. Okay, that's a deal where you need the surgery. But most of these surgeries that are done, you know, for knees and hips and shoulders, for rotator cuff tears and meniscal tears and labral tears, in my humble opinion, should never be done, because we have a way of healing them now, which is regenerative medicine using platelets from your blood or bone marrow and platelets, you know, from your pelvis. And why get a surgery which is replete with so many possible side effects, infections, and failures, when you can walk into my office and have an injection and walk out? I mean, in medicine, be conservative. It's the first law of medicine. Be conservative. Do the thing with the least potential for side effects. And again, I love surgeons. They do the hardest work in medicine, but I think that they're making mistakes about doing a lot of these surgeries. So, and for a surgeon to tell you you're going to need back surgery someday is, you know, that they shouldn't be saying that. I hear it all the time. People come and go, I'm going to have to get surgery. You know, especially when someone has bone on bone. You know, we started talking about that before the break. A person had bone on the knee, but they said they don't have much pain and they're still active. Well, what does bone on bone mean? It doesn't mean diddly. That's just some guy's opinion trying to suck you into getting a surgery. Okay? I get patients with bone on bone, you know, according to other doctors all the time, and they have very little pain. They have good range of motion. So bone on bone doesn't mean anything. Don't get sucked into that. Okay? And you can have an MRI that shows the bones are close together, the cartilage worn down, but that does not mean it's bone on bone. If it's bone on bone, you're not going to be able to move that joint, because the bones are like bricks. You know, they're very porous. And if you have a bone trying to move on a bone with no cartilage, it ain't going to move. So forget that term, bone on bone. Very rare I see a joint that has bone on bone. Very, very, very rare. Anyway, there's good hope for you, Brett. I have to examine you to see what's going on. I'm certainly not going to tell you over the radio what's happening to you. You're still active, though, which lets me know you're not in bad shape. You're having some pain. It's totally a nuisance, and who needs it? But there's a good probability that regenerative medicine of platelets and or stem cells can help you heal up. I need to touch you and feel what's going on to give you a better idea. The phone number to the office, if you want to come in, is 800-300-9300. I'd love to see you and do a consult and let you know what's going on.
Yeah, definitely. I can tell you, though, that I do believe in stem cell research, because a good friend of mine about 5 years ago had stage 4 leukemia, and he went into a experimental program somewhere in Santa Monica where he was treated with stem cells, and he's been in remission ever since.
You know, that's a different story. That's been going on for years and years, and that is now considered traditional medicine. But that's in the field of oncology, and it's different than stimulating tissue to grow back, which stem cells and platelets do. But that's been going on forever, where they take bone marrow and inject that after they kill off the cells in the body that have cancer in them. That's been going on forever. I remember that being done when I was in med school, 30 years ago. So, yeah, you're right. You do believe in stem cells, and it's a whole different thing for orthopedics. Unfortunately, in orthopedics, the orthopedic surgeons don't believe in it, and that's a shame, because they could be doing stem cells instead of cutting people open and causing problems from the surgeries. It'll get there. There are a lot of orthopedic surgeons that are starting to do stem cell therapy for orthopedic injuries, arthritis, and sports injuries. But a lot of them who do it don't really do it. They don't really get trained in it. They'll do it, and if it doesn't work after one time, they go, "Hey, see, it didn't work. Now we got to do surgery." I keep after it. I know it works. I know it doesn't work on every single person, but I know it works on most people, and it's worked on me. And I've had great success using this stuff forever. And I love the work I do. I love watching people heal. It's a great conservative type of medicine that helps people. And it's so simple. You just walk in, basically get an injection. How bad is that? And then walk out.
Not at all.
Yeah, so it's an easy way to heal.
I look forward to meeting you, Doctor.
God bless you, Brett. I'd love to meet you. You sound like a great guy. And I don't think, I can't tell you for sure, but from what you're telling me, I think we can heal you up pretty easily and get you back doing sports and all that without pain.
Awesome. Well, thank you, Doctor. I'll be seeing you soon.
All right, man. God bless you. I appreciate the call.
And we are at 866-870-5752 right here in the studio. Talk directly to Dr. Darrow about your pain, 866-870-5752, and get the free book today, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the foreword is written by Suzanne Summers.
I love it. So I'm going to go to another question, but I just, a thought popped into my mind.
Uh-oh.
A lot of my patients come in and they say, I went to several orthopedic surgeons. They say, if I don't have this surgery, I'm going to end up with arthritis. Now, my experience is when patients who don't have arthritis have a surgery, they do end up with immediate arthritis. Okay? Because the surgeon takes out tissue. I don't like those surgeries. We need that tissue. What we need to do is grow back more tissue. You can't do that with surgery. With surgery, take out tissue. You do a cleanup. I've seen people after a cleanup where their arthritis is so bad, they need to do a joint replacement after that. So that's just me. I'm sorry, everybody. I don't like surgery. I had one on my shoulder. It didn't work out. Luckily, I learned about regenerative medicine. I injected myself and healed up my shoulder literally overnight. And it's been a godsend. This type of medicine I do is a godsend to me. I hope I can do this till my last day on the planet in case I'm injured. Because why should I live in pain? I don't like pain. I like to do sports. I like to be active. And I want to be active till the day that I'm leaving this nice planet of ours. So, Nita, I'm going to go to a question if you don't have anything else for me here.
No, I just give the phone number again, 866-870-5752. We have some time left.
Okay, this is an ankle question. We'll spread this around to different areas of the body. Let's see what this person says. My ankle joint is almost completely eroded, I'm told. Would stem cell therapy work for me? I'm 64, weigh 215. That's probably a problem right there, depending how tall you are, how big bones you are. I've lost about 10 pounds, and I'm watching my diet, eating very healthy. I'm committed to reversing everything that caused this to happen. I'm eating gluten-free with very little meat and mostly vegetarian. Please let me know if this would help for me. So this person has a lot of misconceptions about what they're doing. Unless you're a very big person and you're tall, 215 is way too much weight for that ankle. Losing 10 pounds, I don't know how long it took you to do that, but if you do a ketogenic diet, you'll probably lose about 7 to 10 pounds the first week. That's just a low-carb diet. Watching my diet, eating very healthy. Well, I don't know what that means. Everybody's got their own idea. Eating little meat doesn't mean that's healthy. Being mostly vegetarian doesn't mean that's healthy. Being low carb is very healthy because that lowers insulin, which is inflammatory, causes just about every disease known to man. So carbs are out for health. Not being vegetarian, not eating little meat, okay? I know we hear about these things. Gluten-free, it may be an issue for a very small sect of people, but for most people it doesn't help at all. And a lot of people that are eating gluten-free are eating high-carb gluten-free, okay? So we have to get this straightened out. Anybody who's got lower extremity pain, hips, knees, muscle, ankles, like this person, toes, whatever it is, feet, I get them on a keto diet, ketogenic, Keto, look it up. Basically, it's just low carb. We get our carbs from vegetables, not from grains and other things like that. There's a book called The Grain Brain. It's a great book. There's another book called The Wheat Belly. Read those. The author, I think, is David Perlmutter. He's an MD. And once you read that, you're going to cut out your carbs. So carbs are the killer. And the weight this person has of 215, not good for that ankle joint. Now, the question of completely eroded, I'm not going to buy into that. If that person's walking around, it's not completely eroded. They ask, can they reverse the problems in the ankle? With regenerative medicine, injecting some platelets or stem cells in there, there's a good chance we can grow back some of the cartilage. I don't know anything about this person. I'd like to examine you if you want to come in. The number to the office is 800-300-9300. I'll repeat it for you, 800-300-9300. And the number to the studio right now, if you'd like to talk to me live, I'd love it. Get some more callers in here, 866-870-5752, 866-870-5752. Give me a question that stumps me. I love to get stumped by callers and figure out. I always learn when people call in. I learn a lot about new things, and it's a lot of fun. So we have about 4 minutes left, I guess, here, Nita.
Yes.
So I'm going to go to, actually, I'm going to talk about the vampire facelift again, which is injecting these cells from your own body back into your face to regrow the collagen. If you think you're looking older, this can rejuvenate and make you look more beautiful and younger. And it's a very simple procedure, just injecting this in the face. Very quick procedure, and typically by the next morning, people are feeling a lot better in the way they look. We use it for men and women. Believe it or not, it's about 50-50 about men and women. We think just women want to do it, but a lot of men want to look better also.
Interesting.
So let me go. Here's a few callers coming in, but let me get a quick question, and you can cut me off. Oh my God, the show's over too fast.
We are totally out of time.
I'm sorry, callers, but you can go to the website to get information, www.lastemcells.com, or you can call the office at 800-300-9300. Thank you, Nita. You're a great host. Thank you, Suzette and Alex and all the staff. God bless you all, and thank you, listeners.
And I'm your host, Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.